is the pubic lice or crabs. Crabs is another name for pubic lice. They are tiny insects that can take up residence on your pubic hair. Like head lice or body lice, they feed on human blood. So common symptoms of pubic lice include itching around the genitals or anus, small pink or red bumps around the genitals or anus, low-grade fever, lack of energy, and irritability. You might also be able to see the lice or their tiny white eggs around the roots of pubic hair. A magnifying glass can help you spot them. So if left untreated, pubic lice can spread to other people through skin-to-skin contact or shared clothing, bedding, or towels. Scratch bites can also become infected. It's best to treat pubic lice infestations immediately. The next common STD is a Trichomonas. Trichomonas is also known as trich. It's caused by a tiny protozoan organism that can be passed from one person to another through genital contact. When symptoms develop, they may include discharge from the vagina or penis, burning or itching around the vagina or penis, pain or discomfort during urination or sex, frequent urination, and in women, trich-related discharge often has an unpleasant or fishy smell. If left untreated, trich can lead to infections of the urethra, pelvic inflammatory disease, and even infertility. However, trichomoniasis can be treated with antibiotics. The next is the herpes. Herpes is the shortened name for the herpes simplex virus or HSV. There are two main strains of the virus, HSV1 and HSV2. Both can be transmitted sexually. It's a very common STD. HSV1 primarily causes oral herpes, which is responsible for cold sores. However, HSV1 can also be passed from one person's mouth to another person's genitals during oral sex. When this happens, HSV1 can cause genital herpes. HSV2 primarily causes genital herpes. The most common symptom of herpes is blistery sores. In the case of genital herpes, these sores develop on or around in genitals. In oral herpes, they developed on or around the mouth. Herpes sores generally crust over and heal within a few weeks. The first outbreak is usually the most painful. Outbreaks typically become less painful and frequent over time. So if a pregnant woman has herpes, she can potentially pass it to her fetus in the womb or to her newborn infant during childbirth. This is so-called the congenital herpes that can be very dangerous to newborns. That's why it's beneficial for pregnant women to become aware of their HSV status. There's no cure for herpes yet, but medications are available to help control outbreaks and alleviate the pain of herpes sores. Effective treatment and safe sexual practices can help you lead a comfortable life with herpes and protect others from the virus. Curable STDs. Many STDs are curable. For example, the following STDs can be cured with antibiotics or other treatments such as chlamydia, syphilis, gonorrhea, crabs, or the pubic lice and the trichomonas. However, other STDs can't be cured. For example, the following STDs are currently incurable. Example for this is the HPV or the human papillomavirus, the HIV, the human immunodeficiency virus, and the herpes. So what is AIDS or the AIDS? The acquired immunodeficiency syndrome or the AIDS is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus or the HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. There's no cure for HIV or AIDS, but medications can dramatically slow the progression of the disease. These drugs have reduced AIDS deaths in many developed nations. So, if left untreated, ang HIV or the human immunodeficiency virus, it can lead to AIDS. However, AIDS is very dangerous and more on risky ang life sa tao if naadyo siya AIDS, kaya di man siya curable. Let us now go to the STDs prevention. Avoiding sexual contact is the only foolproof way to avoid STDs. But if you do have vaginal, anal, or oral sex, there are ways to make it safer. When used properly, condoms provide effective protection against many STDs. For optimal protection, it's important to use condoms during vaginal, anal, and oral sex. Dental dams can also provide protection during oral sex. Condoms are generally effective at preventing STDs that spread through fluids, such as semen or blood, but they can fully protect against STDs that spread from skin to skin. If your condom doesn't cover the infected area of skin, you can still contract an STD and eventually pass it to your partner. Condoms can help protect against not only STDs, but also unwanted pregnancy. In contrast, many other types of birth control lower the risk of unwanted pregnancy but not STDs. For example, the following forms of birth control don't protect against STDs: birth control pills, birth control shot, birth control implants, and the intrauterine devices or the IUDs. And also, to the sex workers or what we call the prostitutes, they must or they should be careful and very alert or aware of the things that happens inside their body or to the person they have contacted with. Dapat jud nga mag-amping sila and also use a birth control or mga ways to prevent STDs or contracting STDs because some of the STDs are not curable. Thank you everyone for listening to this report and I hope that namoy nakatunan sa amo ang reporting. Thank you!